Medicare is a program that provides health insurance for people 65 and older. However, it has not completely eliminated disparities in medical care for racial and ethnic minorities. Despite having access to doctors and insurance, members of marginalized communities still face challenges in managing their illnesses and finances. According to Dr. Muriel Jean-Jacques from Northwestern University Feinberg School of Medicine, Medicare has made progress in leveling the playing field, but there are still gaps beyond insurance coverage and cost. If you're a person of color on Medicare, it's important to advocate for yourself to ensure you receive good medical care. Here are some steps you can take to do so. Educate yourself about your rights and the coverage options available to you. Be proactive in seeking out healthcare providers who understand and respect your cultural background. Ask questions and voice any concerns you may have about your medical treatment. Seek support from organizations and advocacy groups that focus on healthcare equity for people of color. For many older people of color, dealing with long-term or serious medical conditions can be challenging. Compared to other races and ethnicities, Black or Hispanic people are less likely to have savings or supplemental insurance coverage to pay for their medical costs. On top of that, many older people face economic challenges and barriers due to racism. But if you're struggling financially, it's important to be open with your doctor about it. Your care team can help you find ways to cover your costs without interrupting your health care. One way to get help is to speak with a social worker or health advocate at your hospital or doctor's office. They may be able to guide you toward national or local programs that can provide assistance, such as prescription assistance, extra health coverage, and Medicaid. When it comes to paying for medication, there are options beyond Medicare Part D. You may be eligible for assistance through programs like Medicare's Part D, Extra Help, Low-Income Subsidy, state assistance programs, drug makers, and drug discount cards. In addition, consider adding a private health insurance plan to lower out-of-pocket costs not covered by Medicare. And for those who qualify, Medicaid can provide low-income health coverage. So don't be afraid to ask questions and advocate for yourself when it comes to your healthcare and medication costs. Advocating for yourself as a person of color on Medicare means knowing your benefits and asking the right questions. If your doctor can't answer all of your questions, reach out to a social worker or your local state health insurance assistance program, SHIP, for help. You can also contact a licensed Medicare broker approved by the National Council on Aging for assistance. Here are some questions you can ask. Is my cane or wheelchair covered? How can I get meals paid for? Who can help me pay my rent and utilities? Can I get low or no-cost transportation services? What medical benefits does Medicare pay for? What are the out-of-pocket costs and how much might I have to pay each year? What supportive equipment can I get with my benefits? You can also share specific needs, like if you need help getting down a long hallway to prepare meals. Remember, you don't need to have all the answers, your healthcare team is there to help you navigate the system. It's common for people to feel more at ease when they see a doctor who shares their race or ethnicity. However, this may not always be possible for people of color due to the lack of diversity in the healthcare workforce. Dr. Jean-Jacques highlights the importance of being able to identify a compassionate healthcare provider. Some key indicators include the doctor or nurse greeting you, using your name, making you feel like a partner in your medical care, providing clear advice about treatment options, and validating your symptoms. It's crucial for your doctor to fully understand how your symptoms impact your daily life, and this is where advocating for yourself becomes essential. As a person of color on Medicare, you may often feel overlooked during medical appointments. This can be especially true for older Black women. It's important to advocate for yourself and ensure you are heard and seen by your healthcare provider. One way to do this is by bringing someone with you to your appointment, such as a family member, friend, or professional advocate. This extra support can help you feel more confident and ensure that all of your medical concerns are addressed. Additionally, pay attention to how well your provider listens to you and addresses your health issues. If you feel dismissed or not taken seriously, it's important to speak up and advocate for yourself. It's also helpful to have someone with you who can support and speak up for you if needed. It's important to challenge any preconceived notions or biases that may exist and ensure that your healthcare provider takes your concerns seriously. Remember, you have the right to advocate for yourself and ensure that you receive the best possible care.